Now, to new research on Ozempic and alcohol. It finds that the weight loss drug may also help prevent alcohol overuse and abuse. Dr. Jen Ashton is standing by. First, Harold Reshef has the details.
I have no desire to drink wine anymore. And that's crazy to me because I couldn't stop before.
This morning, the wildly popular drug used for weight loss, semaglutide, is now showing very early signs of potentially curbing alcohol use for those who drink excessively. A new case study composed of 6 people screening positive for alcohol use disorder, or AUD, found that they all saw a clinically significant decrease in symptoms while they were using semaglutide for weight loss. Christy Martin, who was not part of the study, says while she used to drink wine every night, her urge to drink has disappeared.
Drinking for me was becoming a bit of an issue, and the fact that I just have no desire for it is something I didn't expect and is just an amazing side benefit. I can't even tell you.
This small case study now setting the stage for larger clinical trials, looking at semaglutide as a treatment for AUD, as researchers explore whether the drug has the potential to treat other excessive use conditions.
And again, this initial study only included 6 patients, but as you heard, more thorough studies are already underway. It could be years before we know the true results, but certainly reason to hope.
Sure is. Okay, Ariel, thanks very much. Dr. Jen is here. You know a lot about these drugs. You're board certified in obesity medicine. What does this study tell us?
So, George, what's interesting about this is astute doctors for years who have been managing patients on the GLP-1 agonist, that's the semaglutide class, for weight loss and treating obesity, have started to hear anecdotal reports of this. This small case study of these 6 patients was really one of the first times that reported in the literature their experience with their cravings for alcohol use, their subjective experience with that, really powerfully documented. Theories are that it works in the brain, in the reward center, but this could be a major indication.
I have to say, we know a lot of people who are taking these drugs, and they report the same thing.
Absolutely, they do, yeah.
But what other treatment options are available for substance abuse disorders?
Well, this is one of those bright spots, is that it sheds light on what treatments are already existing and how they're not being used. There are 3 FDA-approved medications for people with alcohol use disorder. They are vastly underprescribed behavioral interventions, and then tech-based or app-based therapies, obviously increasing in popularity and research, but they have a role as well. But all of these things, this isn't about just, potentially choosing one. It's about if you have an alcohol use disorder or substance use disorder, filling the boat and getting as much treatment as you can to make a big change in your lifestyle.
As we were just discussing, it really seems like a miracle drug. Why do you think that there seems to be a stigma against the use of these kinds of drugs?
I think the social backlash, Lindsay, is huge, whether it's for weight management or mental illness, and that really it's just wrong. If you had high blood pressure, you would treat it. There's a role for these. It's not for everyone. It's not one size fits all, but you have to factor in the risk of not taking a medication like this versus the benefits of treating it when you weigh those options.
Seems like so helpful. Diabetes, weight loss, alcohol, you name it. All right, Jen, thank you so much.